Hi, I'm Ryan Maines, physical therapist at Inland Therapy Pathways. One common thing I see here in the clinic is headaches, mostly associated with tension headaches. And I would have to say it relates a lot to posturing. If you can see here, when the head starts to fall forward, whether we're working on a computer, at a desk, looking at our phones, just like any sort of leverage, if you hold a weight close to your body, it's not as bad versus holding the weight away from your body. So that weight of your head, when it's further away from that center of mass, it increases the tension applied to the back of the neck. And so the other thing you see is if when it falls forward, we don't look at the floor, we usually look up at our surroundings. So you can kind of see a crimp action happen right there at the base of the skull. And what's happening is, I call them the headache muscles, but your suboccipitals are hyperflexed to keep your head up, and they're pulling on blood vessels and nerves and even just the scalp itself, creating some tension there to prevent some blood flow and nerve flow that usually results in those headaches. So a few things that I suggest to my patients is, let's first go after your posture. So what you want to do is sit yourself up tall, and you don't just hyperextend your spine, you actually try to pull through your shoulder blades, like you're trying to squeeze an egg between the blades, okay? Making sure they're staying back and down. Don't shrug up, because now you're hyperactivating those muscles that are already tense. So get them back and down, and then you want to do what I call the chin tuck. Make a double chin for yourself. So as you pull that chin back and try to rebalance your head over your shoulders, right? Get your ear in line with your shoulders. It does make it look like it's a double chin, but it opens up. You can see the difference, right? Where this closes and crimps it down. This opens it up, decompresses that spine, and helps stretch those suboccipital muscles to reduce that tension on there, and also improve the flow of nerve flow and blood flow. Another thing that I like to do to help is just make a $2 assisted device where it's 2 tennis balls just taped together, where you can put them in a sock, tie it down, and it fits nice perfectly between the spine or along either side of the spine, and that can really hit on those suboccipital muscles. So for an example, just lay it down on your bed, and you come to it right here, and your hands will come and help support it so it stays in the place you want it, and you put it right at the base of the skull, and you just let gravity and let the weight of your head press into it. And while you're here, you can gently do nodding of the head up and down, left and right, and it really helps to put pressure on those spots, hit it just right to make those headaches go away. So if I ever have a headache that's about to come on just from stress or whatever, I go to my little headache tool and I lay on it for about 5 minutes and do those mobilizations. I can usually beat my headache before it gets bad. But anyways, just some tips for you. If you have any questions, reach out. Have a good day.